Hey, welcome to a conversation with CHC. On this episode, we are going to discuss health savings accounts called HSAs by most. We've all, I think, felt the strain of rising healthcare costs. Inflation is through the roof and causing families to struggle to afford their healthcare and see a doctor or afford a prescription. In fact, by 2032, just a few years away, the typical American family will spend 40% of their income just on healthcare. And that's crowding out everything from food to education to housing, and making things a lot more difficult for a typical American family. And so I'm excited today to talk about HSAs. About 61 million Americans today have an HSA. And the question I get asked the most is, what the heck is an HSA? And so I think having been there at the creation of the law that created HSAs and working with my good friend, Dean Clancy, who's joining us today, I would say they are nothing more than an account that you use side by side with your health coverage. That health coverage has to have a minimum deductible, but that account is tax advantaged, and you put a deposit in that account and you use that deposit to pay for stuff like a doctor's visit or a prescription at a pharmacy or something maybe that your health coverage doesn't cover. And so that money is owned by you, which means you get to take it when you leave a job or you go through a life event. Maybe you get married and you drop out of the labor force. That's your HSA. You own that. And the money is yours to use and save for maybe future healthcare expenses. And the cool thing about the accounts is because they're tax advantaged, everything you buy is discounted by as much as 37%. And so you get a discount right off the top of that drug you buy or that physician you go see. And we're going to talk about all that and how that all works. Current population, we've got more than 360 million Americans living in the US, and just 61 million have an account. And so if these accounts are so great, what about the other 300 million? Why don't they have an account? And the answer is there's federal and state rules and laws that stand in the way of patients opening up and using an HSA to get savings and lower healthcare costs that need to be changed. And so joining me today to talk about HSAs is a freedom advocate and a longtime proponent of health savings accounts, Dean Clancy. Dean is with Americans for Prosperity and has been a longtime friend. We worked together on the Hill many moons ago, but he also worked for two presidents and has been working to expand HSAs and make them work a little bit more effectively for consumers for a very long time. And so, Dean, I want to welcome you. Thank you for being with us today.
Oh, it's my pleasure, Joel. Always a pleasure to be with you and to discuss HSAs.
Yes. So talk a little bit about how HSAs help lower healthcare costs for consumers.
Well, HSAs do it because, you're getting a tax break, that helps, but they change how you think about your healthcare. They encourage people to shop for value. When you're spending your own money, you tend to spend more wisely. You spend less, the studies show this. You also spend more carefully. And interestingly, you don't necessarily stint on prevention, like the routine checkups and so on. You might think some people would just want to hoard money in their account and let it build up. No, they spend it on things that keep them healthy. It's the same thing that happens when you get an oil change for your car. You're doing a small expense now in order to prevent a much larger future expense. Same thing happens with health savings accounts. So we know from studies that people shop around, they find lower prices, they spend less, but they spend more wisely. And if everybody had an HSA, you would see the whole country benefiting. You would see healthcare prices starting to come down or not grow so fast because of the dynamic that happens when people are in charge of their own healthcare.
So sounds like price transparency is probably a pretty big, important side-by-side policy that needs to happen with HSAs.
Transparency is absolutely essential in healthcare. With an HSA, you're more inclined to ask your doctor, how much is this going to cost? Or is there a more affordable way to do what you're recommending? Right now, people who don't have these accounts and who are relying on their insurance to pay for everything are less inclined to ask those questions. With an HSA, you do ask them, and that forces your medical providers to answer. How much would it cost? Well, since you're paying directly, not through your insurance, here's the price that we charge. And that helps instill some competition in the system because providers know you could take your business elsewhere. So we need price transparency, and HSAs help to drive price transparency.
And Dean, you mentioned something interesting, the oil change analogy, right? Like is that on HSAs, we obviously have RFK Jr. at the head of Health and Human Services, key advisors like Callie Means, who have been long proponents of HSAs. HSAs, I guess you could spend it on wellness prevention type activities that maybe the insurance company doesn't cover, and that bends the cost curve long term, right?
Yeah, you can spend an HSA on any federally qualified medical expense, which is pretty much anything you can think of that qualifies as healthcare. It's doctor's appointments and diagnostic tests and lab tests and MRIs, imaging, and of course, yes, medicines and wellness. You can even buy it, use it to buy healthy foods and dietary supplements, exercise equipment, if you have a letter of medical necessity from your doctor. If you need that thing for your health care and you have a doctor's note, you can use your tax-advantaged HSA dollars to pay for it.
A lot of people are shocked that the typical Obamacare plan, Silver plan, has about a $5,000 deductible, but a typical HSA, the average HSA deductible is about $2,300. And they're shocked because they think of HSAs as a high deductible plan. Do you run into the same thing?
Well, yeah, I absolutely do. And it is amusing that because of government policies, most people out there are finding that the deductible, that's the amount you have to pay before your insurance kicks in, is really high these days. $5,000 is not an unusual deductible. It's almost like not having insurance at all for a lot of families, whereas an HSA qualified health plan might be only $2,300, which is much more usable in terms of insurance. You still have to pay something, but it's not as much as those other plans that most people have access to.
So, Dean, one of the bills CHC has gotten behind is the HSA Modernization Act. There's lots of bills on the Hill. You want to run through kind of your list of favorites, and I can talk a little bit about HSA Modernization Act.
Sure. Well, folks should be aware of the Access Act. That's Access is in all capital letters. This is a bill which AFP and the Paragon Health Institute put together in consultation with Mr. HSA Roy Ramthan, who's an old friend of ours, and the National Taxpayers Union. It's a very simple idea. Give 5 million lower income Americans a government funded HSA using money that the government is already spending to help them pay for their health care, and thus give them more control over their health care. Let them buy things that maybe their health insurance doesn't cover, and at no cost to taxpayers, because you're just spending money that the government is already devoting to these folks' health care. That's called the Access Act, and we support that very strongly. A bill called the Primary Care Enhancement Act. This would allow you to use your HSA for direct primary care. And for those who don't know, that's a new model of care delivery. It's like a Netflix subscription to your favorite doctors, and you pay them monthly, and they make themselves available to you. And patients love it, doctors love it, but our current laws prevent people from using their HSA to use this exciting new model of care, direct primary care. So the Primary Care Enhancement Act would fix that problem. The Medicaid Improvement and State Flexibility Act would allow tens of millions of Americans who are enrolled in the Medicaid program. That's the government health insurance program for lower income families. It would let them have an HSA that they would use for primary care and non-emergency medications. It would save taxpayer money because these folks, when they're using an HSA, use the hospital emergency room less often. That's one of the big problems with Medicaid. People go straight to the emergency room because they can't find a doctor who will see them in a timely way. It's a problem with the Medicaid program. This bill, the Medicaid Improvement and State Flexibility Act, would help overcome that by giving low-income Americans an HSA account that they own and control. And one more bill, Joel, and then I'll let you talk. The HOPE Act. This is by a congressman from Utah. It's bipartisan, and it's very exciting because it would enable all Americans to have an account very similar to an HSA alongside today's HSAs. It would not change HSAs, but it would create another very similar account that is designed just slightly differently, and as a result, virtually every American could have such an account. It wouldn't be quite as good as an HSA because your contributions to the account would not be tax deductible. That's one of the great things about HSAs. The money going in is tax-free, the money building up inside the account is tax-free, and the money coming out of the account for medical expenses, tax-free. In fact, it's the only account in the entire tax code that's that generous. These new HOPE accounts would not be quite so generous, but a lot of people could have them. And it has a strong bipartisan backing in Congress. And it's just one of the many bills that we support that would increase Americans' ability to have and pay for and save for health care tax-free.
I think those are all great ideas. I think the big challenge that we see at CAHC is, I alluded to it earlier, we got 61 million people enjoying HSAs today, but we've got these federal and state rules that kind of stand in the way for the other 300 plus million Americans to get cheaper healthcare. And so we've really focused on trying to expand eligibility by breaking down those laws and rules that stand between a patient and an HSA. And I'm really excited about the HSA Modernization Act. This was introduced by Congresswoman Beth Van Dyne from Texas. It would basically say across these programs, Obamacare, Medicare, Indian Health Service, Veterans Affairs, that we're going to get rid of those rules and make sure that people can access these accounts. And focusing on that eligibility and expanding the universe of people eligible for an HSA means they'll have access to a plan that's got a lower premium. Compared to Obamacare, it's got a lower deductible. Compared to Medicaid, you've got better access to doctors and drugs. So it solves a lot of problems right off the bat. But then the other one I think of is the one that would basically delink the deductible from the HSA from the high deductible requirement in the law. And that is could be electric, right? Because it would basically say, if you've got an employer plan, which most Americans do, more than 160 million people on a private employer coverage, the employer can design the plan how they want, but then you can have an HSA to fill in the gaps. And that could potentially expand to almost 200 million people, and would create that ownership over your healthcare that you can take whenever you leave your job, whenever you experience a life-changing event, through cheaper healthcare, more informed decisions, more empowered patients and consumers. So those are the two bills that we're really excited about, that I know we're all working on all of these ideas to try and get them into the budget bill that Congress is considering. Do you want to talk a little bit about what's next for this legislation and maybe what people can do about it?
Yeah, this year, 2025, we have a big chance to expand HSAs, to pass the HSA Modernization Act and some of the other bills that we've just talked about, because Congress is moving big piece of legislation through, they call it budget reconciliation. It really has to do with maintaining existing tax rates, not preventing devastating tax hikes, and they're open to doing things that also make healthcare and other areas of our lives better. And so Joel and I and others are working hard to try to make sure we use this opportunity to do that. Congress they're considering the bills right now as we speak, and we're talking to folks on Capitol Hill to try to get these ideas into the legislation. My guess is by the late summer, July, August, the deal will be done, the bill will be signed, if all goes well. And hopefully we will have legislation enacted that takes us from a really great HSA world to a really fantastic HSA world.
And I think to your point, Dean, now's the time to act. There's this once in a generation opportunity, in my opinion, to expand HSAs, get more people lower cost healthcare. We got to ask Congress to get it in the bill. And that bill is going to be considered before Memorial Day in the House, and maybe go to the president by July 4th. So now's the time to contact your member of Congress. Go to house.gov or senate.gov. There's lookup tools there where you can find out who your member of Congress is or your senator, and reach out to them. Just send them a note and say, I want you to expand HSAs, or mention some of the bills that we've already talked about. If you want to learn more, though, I know you can go to americansforprosperity.org or chc.net. And there's plenty of tools there that you can learn more about this stuff and be connected to your member of Congress and weigh in. Dean, I really enjoy, I've always enjoyed working with you. You are a mover and shaker in the HSA movement, and so glad that you're fighting for this expansion and for lower costs for all Americans. Appreciate you being here today.
Oh, the feeling's mutual. HSAs for all.
Thanks, Dean.